Hello, everybody. I haven't seen you in a while. It's been at least 2 weeks. I'm sorry. Schoolwork has killed me. So yeah, before you scrub in, this surgery may contain graphic producers for inappropriate for children or squeamish adults. Okay, I'm squeamish, and I doubt this is gonna be inappropriate for me. So here we go. It's an ingrown toenail surgery. I don't think it's gonna be that inappropriate. Maybe the content that's in it, like the foot and how gross it is, but alright, so I'm gonna stop talking because apparently when I talk I'm too loud, so you can't hear the guy talking. So here we go.
Hello, and welcome to Surgery Squad's virtual ingrown toenail removal. I'm Dr. Jeff, and I'll be guiding you through this procedure today. An ingrown toenail happens when the edge of the toenail grows down and into the flesh of the toe. When this occurs, there is usually a moderate amount of pain, redness, and swelling around the toenail. An ingrown toenail is usually caused when extra pressure is applied to the toe due to shoes that are too tight or too loose. Improperly trimmed toenails, foot or toe deformities, injuries, and fungal issues can also be contributing factors. There are some ways to treat an ingrown toenail at home to relieve some of the pain, but remember that you should never attempt to remove an ingrown toenail yourself. If you're a diabetic and have an ingrown toenail, it is recommended that you go to the doctor immediately. Now that you understand the causes of an ingrown toenail, let's put on our gloves and remove one.
Alright.
Our patient is ready, so let's begin by disinfecting the toe.
Disinfecting the toe. What do I do?
Now, we need to numb the toe with a local anesthetic. We'll have to inject the anesthetic in several locations around the toe.
Okay. Oh my god. Oh my god. My friend Nate in elementary school. If you thought poor Joe was disgusting, get ready.
Great. Now, a few minutes for the toe to get numb.
I like that music. Yeah.
Now that our patient's toe is numb, place the special tourniquet around the toe. This will help reduce the amount of blood coming from the wound. Once you've done that, we can move on to removing the ingrown portion of the toenail.
Okay, so it's just like a rubber band. Ew, that sound that it made.
One blade of the nail anvil under the affected nail.
Oh my god,
We're going
no.
to go down the nail until we feel a little bit of resistance. Our patient's going to feel some pressure as we cut away the ingrown nail.
We're gonna freaking cut it?
Great.
No.
Take the forceps and carefully remove the ingrown nail.
No. Oh!
It's getting kind of messy in there. Let's clean up that blood.
Okay. Gladly. Ew, that's disgusting.
Substance right there? It looks like the patient has a bit of infection in the toe. Firmly squeeze the edge of the toe.
Oh my god, that's disgusting.
That toe is starting to look much better.
No, it's
We're not done yet. Next, we're going to apply some phenyl acid to the wound. This will help ensure that the problem of ingrowth will not reoccur in this toe. When you're done inserting the acid, I'll remove the tourniquet and we'll finish up.
Okay. Alright, rubber band's gone.
Some antibiotic ointment on a sterile gauze pad.
Antibiotics?
Place it against the toe and wrap it in a gauze bandage.
Okay. Is that it?
Fantastic job. Since there was some obvious infection, our patient will be sent home with a prescription for some antibiotics. We'll also need to tell our patient to keep the wound dry, clean the wound regularly, and replace the bandage 2 to 3 times a day. While our patient's toenail isn't likely to regrow, his condition is likely to return if he doesn't take care of his feet. This includes wearing proper fitting shoes, properly trimming his toenails, and keeping his feet clean and dry. And that's how we remove an ingrown toenail. You did a great job today. While you're here, try your hand at one of our other surgeries here at surgerysquad.com.
Alright, so we're gonna go ahead and try the virtual braces. And if the screen jacks up, I'm sorry, I'll try to get it right off the bat right away. So, no, the C-section's gonna be like, C-section, nope, that's gonna be inappropriate for me. Alright, sorry about that, the thing's gonna get all jacked up. Okay, alright, back. Okay, so I'm gonna stop talking for a couple of seconds, for a second or two. And who's ready for freaking the finals tonight? Steph Curry.
Welcome to Surgery Squad.
Crap.
I'm Dr. Jeff.
Hi.
And today we're going to talk about braces, those fantastic bands and wires that help straighten out crooked teeth. Let's face it, most of us do not have perfect teeth. Everyone's smile is unique. Some people's teeth are just a little more out of shape than others. Your teeth might be crooked, or your upper and lower jaws might not be the same size. If your upper jaw is bigger than your lower jaw, that is called an overbite. If your lower jaw is bigger than your upper jaw, you have an underbite. Sometimes your mouth is not large enough for all your teeth. That is referred to as overcrowding. In all of these cases, the problem can be fixed with braces. Braces are a series of brackets, wires, and bands that are used to guide your teeth back into the correct position. This improves looks, makes it easier to chew, and at times even improves speech. Our patient today has what looks to be an overbite. We want to see how noticeable it is. We'll start by getting a record of the current state of her teeth in many ways, including x-rays, impressions, and photographs. We'll start by taking some x-rays.
Alright, so who's ready for the freaking game tonight? Steph Curry and
Say hello to
LeBron
painless paint
James.
prep with Scotch Blue pre-taped painter's
Are
plastic.
you kidding me?
Just prep,
Hold on.
paint, protect,
Oh, 5, 4, 3, 2,
pull off a
1.
better paint job with
Okay. So click the X-ray right there. Yes. What if-
Next, we'll take an impression of the teeth. We put a special gel on the bite mold. The gel comes in lots of terrific flavors, like candy cane and chocolate cake. Can you put the mold in the mouth?
Well, I want chocolate cake when I get my braces.
Great job! We'll have my assistant make the bottom impression. Once we have them both, we'll use the impressions to make a plaster model of the patient's teeth. Okay, we've got our impressions and x-rays, and we can see that our patient needs braces. I've also taken some photos for our before and after wall. We'll arrange an appointment for next week to put the braces in place.
That music though.
Our patient is back, and we're ready to put on her braces. In some cases, a patient may need spacers placed between the teeth for a week to
Alright,
create
I
more
don't
room
care,
for
I
the
don't
bands.
care, I don't care.
Our
What
patient
is
does not.
happening with my
We'll
screen?
start by polishing all the teeth. Making sure there is no debris on the teeth will ensure that the braces adhere better. Run the polisher over the teeth to clean them.
Oh, I hate this when that happens at me.
Wow! What a marvelous job! I can almost see myself in those teeth. We need to put on some molar bands to anchor the braces. They circle the whole
No
tooth and have a
turn
hook
back.
on the
Just
outside
keep
of
your
the tooth.
eyes on
Slip the molar.
my broken boys. You pick them up.
Great. Now we can start putting the
Okay.
bonded brackets on the rest of the teeth. We've placed a lip guard over the teeth to give us room
Okay.
to work. Let's rinse off the teeth.
I want braces,
Can you spray
but
them with water?
I
I run the suction to remove the water.
I really want braces, but I don't know how painful it is to get
Let's
the surgery
spray some air to
done.
get the teeth nice and dry.
I need them.
Can you handle
Trust
that for me?
Oh my god, I so need them.
With the teeth dry, we'll now put a small amount of bonding agent on the teeth. Wipe a little bonder on each one.
Bonder.
We let the bonder dry for a minute or two so that it is sticky. Then we place a bonded bracket onto it.
That's what's on my freaking teeth sometimes. Okay. God, your teeth are jacked up, like more than mine. Okay, that's it.
I will scrape off the excess bonding agent with a dental pick. Now use a curing light to harden the bonding agent under the brackets. Click to turn on the curing light. Great job! Now I'll put the bonded brackets on the rest of the teeth. There we are. While I was at it, I readjusted the molar bands and cemented them. We're ready to place the arch wires. The arch wire is a thin wire that connects all of the teeth by going through each bracket.
Okay.
Let's slip the wire into the brackets of the bands on the molars. Move the wire to the mouth to put it in place.
Okay.
Good job. We do not want the wires to poke our patient, so now that they are all snapped into place, I'll reduce the ends by clipping them off with pliers. And there we are. The arch wire is in place. Now we'll use elastic ligatures to make sure the arch wire does not fall out of the band. The ligatures are little.
I want braces like those. I literally want pink braces.
Using a different pair of dental pliers. Now you try. Place the ligature over the brackets indicated.
Okay.
And with the last ligature in place, our patient is done for today.
All right.
In the next few days, she might experience some initial discomfort. She should plan on eating soft foods and taking over-the-counter pain relievers if needed. Orthodontic wax can also relieve discomfort. If there is a real problem, she can always call the orthodontist.
Yep.
It is important to take more time brushing and flossing when you have braces, as food can get lodged between the wires and the teeth. Our patient will have regular appointments about once a month for the next 6 months, and then space them out after that. The treatment usually takes about 1 year with braces, and then additional time with a retainer.
Okay.
The true length will vary by patient.
Our retainer looks
She might
cool.
also need additional equipment such as elastic bands, coil springs, or headgear. We will not know until we see how she responds to the braces. There you have it. The braces are in place, and our patient is on the way to a beautiful straight smile. Thanks for coming by Surgery
Alright,
Squad.
so
Why
that's...
not check out one of our other procedures here on surgerysquad.com.
Alright, so that's gonna be it for this video. I hope you all enjoyed my ingrown toenail and braces surgeries. And the ingrown toenail surgery, oh my god. I could tell why it was not for squeamish adults. But, yeah. Hope you guys enjoyed that video. And I'm sorry I haven't been uploading in a while. Schoolwork has, let me down. And, second thing, I hope y'all are gonna watch this game tonight. Please watch that before my game. I want you to see the frickin' Golden State Warriors versus, Cavaliers. So, it's basically a matchup with, the Splash Brothers and Kyrie Irving. And Kyrie is injured, but he says he's fine. But yeah, Splash Brothers versus LeBron James and Kyrie Irving. And Kevin Love, but I was just saying Kyrie Irving, though, and LeBron James. Hope you guys enjoyed my video, and I'll see all you dudes in the next video.